To speak in this debate as a member of the Health and Social Care Select Committee and also as a Member of Parliament for Worthing West. At a local level, University Hospitals Sussex have implemented huge improvements of late, following the alarm being raised about the safety of our maternity services after a number of heartbreaking, avoidable baby deaths came to light. And for the families affected, life will never be the same again. And there will now be a review led by Donna Ockenden to make sure that the truth of those times is fully heard and understood, and that the indescribable experience of those families is documented to best effect and lessons embedded in future practice. This review will also contribute to the improvements that are already making a difference in the maternity services in University Hospital Sussex, including in my own hospital in Worthing. In a recent CQC inspection, the maternity services have now been rated as good. And this reflects the maternity survey, where 98% of women said that they felt they had been treated with dignity and respect during labour and birth, and a similar 95% felt involved enough in decisions about their care. We have heard from so many of our colleagues this afternoon about so many times when this has not happened, so I take great hope that this survey is so positive. Improvements in these maternity services have included 24/7 birth supporters, working with experts by experience to create a restorative culture, bespoke antenatal pathways for asylum seekers and refugees, and specialist midwifery support for traveller communities. There is strengthened staffing capacity, with 40 additional qualified midwives recruited across the Trust maternity units. Maternity units are now fully staffed, compared with a vacancy rate of 15% at the time of the previous inspection, and what a difference that has made. And this level of service improvement and delivery needs to be a requisite for all maternity services in this country, and the soon-to-be-published AMOS review recommendations, of which we have heard about this afternoon, will undoubtedly provide a clear blueprint for the National Maternity and Neonatal Task Force to move this forward. But let us be in no doubt, as has been heard, we have had 700 recommendations to date. We probably know what's going to be in the AMOS review, so let this be the last one. Because the tragic fact, in spite of these excellent improvements I've seen in my local area, is that in 2022 to 2024, the overall rate of maternal death in the UK was 20% higher than it was in 2009 to 2011, when the government of the day set an ambition to halve the rate of maternal mortality in England. And although life of a precious baby is priceless, clinical negligence does have a price tag. And the NHS has faced an estimated £27.4 billion bill for maternity negligence in England since 2019. And this figure exceeds the total maternity budget for the same period and reflects a devastating toll of preventable deaths and life-altering injuries to mothers and babies. There has been a significant investment in increasing the number of midwives over the past 18 months under this Labour government. And since December 2024, an extra 800 midwives have been recruited. But this is not enough on its own. There needs to be, as we've heard so sensibly from my colleagues, widespread system change and a continuum of care. We have also heard from my honourable friend about the issues around black maternal health, and our very own Health and Social Care Select Committee highlighted this in its inquiry, where we saw that black women in England continue to face disproportionately poor outcomes in maternity care and the highest maternal mortality rates. Babies born to black women are over twice as likely to die in their first year compared with babies born to white women. A fact that in this day and age I find incredible. As somebody who has worked in the NHS as a doctor and is now a public health consultant, it really is entirely unacceptable that continues to be the case. So the task, therefore, is accountability, coordination, and ensuring that evidence-based recommendations drive rapid improvement for women, their babies, and the hard-working staff. The Women's Health Strategy, published last week, recognises that women's birth experiences and outcomes are a fundamental aspect of high-quality healthcare. Maternity services need to be embedded in a model based on relationships and wider care. That is essentially what health services are. Live or die on. If we do not have good relationships and good wider care, our health services will struggle. and how we organise our services needs to change. And I know that this is a core mission for our government, shifting to community-based care in the neighbourhood health model. £200 million has been invested in the Healthy Babies programme to improve perinatal mental health, parent-infant relationships and infant feeding in 75 local authorities, which is part of £900 million that's been allocated to Best Start family hubs. And the Best Start in Life campaign includes information on pregnancy, but we must ensure that maternity healthcare is fully embedded in the shift to neighbourhood care. And be in no doubt, we have talked about moving from hospital to community in the 20 years that I have been in public health and medicine, and we've yet to do it. So I'm under no illusion this is incredibly difficult, but the focus we have this time is welcome. So in summary, considering the improvements that have been made in my own area by University Hospitals Sussex and the significant steps that are being taken by the government in establishing the task force led by the Secretary of State, investing in midwives and more broadly women's health and community-based care, I do think that we are seeing positive action starting to take hold. Following the publication of the AMOS review, the Minister may want to consider the possibility of a maternity commissioner to carry out the work of the task force, but the primary driver of this decision must be to embed the progress that is being made now and to sustainably embed a safe, holistic, person-centred approach across maternity services that can endure and adapt for many generations to come.
Okay.